How prenatal and postnatal stress impacts toddlers in the U.S. at age 3. My research topic is how prenatal or postnatal stress impacts toddlers in the U.S. at age 3. In this presentation, I will be defining prenatal and postnatal stress and the factors that impact the development of toddlers at age 3. I chose this topic as my career interest topic because my niece is not developing as a toddler at her age should, and I wanted to know how to combat this. Also, I want to work in pediatrics. The field of pediatrics encompasses the physical, mental, and emotional care of infants, children, and adolescents up to the age of 21. This topic relates strongly to my career goal because it relates to all the factors stated above. My thesis is, children at age 3 develop at their own pace. However, parents that experience a stressed pregnancy should have their child evaluated if they are developing abnormally at this developmental milestone age. The excuse of "they will grow out of it" is no longer acceptable at this age because the outcomes of prenatal and postnatal stress can promote unfavorable outcomes for their toddlers subsequently. Prenatal stress is stress experienced during pregnancy. Postnatal stress, sometimes referred to as postpartum stress, is the stress experienced following childbirth. Prenatal stress can affect the critical development on a fetus, producing adverse effects. Although postnatal stress does not affect the toddler as much as prenatal stress, postnatal stress can affect the behavioral and temperamental outcomes of the child and can result in cognitive delay of the toddler. According to Kingston and Tuff, both prenatal and postnatal stress play a role in the global development, behavior, and social-emotional development, with a similar number of studies reporting small and medium effects. The key factors that impact the development of toddlers include the type of stress, genetics, environment, effects of the stress, and the type of intervention or treatment. Prenatal stress has varying effects on a toddler's development following childbirth. According to Tremblay, Boivin, Peters, and Glover, both altered brain structure and function have been shown to be associated with prenatal stress. Prenatal stress has been associated with varying adverse effects on toddlers including cognitive, social, and neurodevelopment delay. Postnatal stress has a negative effect on the temperament, sleep, separation anxiety, and lower cognitive performance of toddlers at age 3, and it enhances the effects of prenatal stress on toddlers. The varying effects postnatal stress can have on the toddler development include social, behavioral, cognitive, and language delay. Association between prenatal stress and offspring birth rate, gestational age, and antisocial behavior is seen in both related and unrelated mother-offspring pairs. The authors found that the association between offspring and prenatal stress or anxiety and offspring outcomes could arise from inherited factors and postnatal environmental factors. Genetics can affect stress vulnerability, behavior outcomes, and the development of toddlers subsequently. The association between prenatal stress or anxiety and offspring outcomes may be attributable to postnatal maternal anxiety and depression, according to Rice. In Glover's research review, published in 2014, one study found that toddlers have shown to have a more difficult temperament, sleep problems, and lower cognitive performance and increased fearfulness associated with maternal stress during pregnancy. Stress at age 3 affects a vast range of developmental milestones including physical and psychological development, cognitive development, motor skills, neurodevelopment, and social development. The type of intervention or treatment needed varies according to the developmental delay the toddler experiences. Types of treatment include cognitive behavioral treatments, behavior therapy for parents or children, medication, school accommodations, and psychotherapy. Types of intervention include cognitive behavioral interventions, school intervention, primary care clinic monitoring and assessment, and psychological assessments.